Welcome viewers to this program on primary prevention of heart disease and the role of Universal Healing Program, popularly known as UHP. According to recent reports of the World Health Organization, coronary heart disease is the #1 problem among the young all over the world. Incidence of coronary heart disease is probably the highest in India. We have with us today a panel of highly distinguished medical practitioners, all of them cardiologists, who will be sharing their thoughts on prevention of heart disease and other related issues. I'll introduce to them this trio of highly accomplished professionals in their respective fields. First, Dr. Ramesh Kapadia, a practicing consulting cardiologist in Ahmedabad, having his practice for over 5 decades. He is very passionate about prevention of heart disease, and he got inspired by Dr. Dean Ornish and Larry Dorsey, both from the United States, to start the Universal Healing Program 26 years ago. He combines the wisdom of the East and the scientific knowledge of the West. We also have with us today Dr. Subhashchan Manchanda, who is a cardiologist and a senior consultant at the Sir Gangaram Hospital at New Delhi, and a professor and head of cardiology department at the All India Institute of Medical Sciences. He also has a rich experience of over 4 decades, and he has done a lot of research in the field of reversal of heart disease and preventive cardiology. Finally, we have with us another expert, Dr. K.R. Balakrishnan, Director, Cardiac Sciences and Chief Cardiothoracic and Transplant Surgeon at the Fortis Malar Hospital in Chennai. He also has over 3 decades of rich experience in this field, and is considered as one of the best heart transplant surgeons in India, and also an expert cardiologist in the field of end-stage heart failure. I welcome all 3 experts to this program. It's a paradoxical situation that in spite of the great work done in medical research, the better quality of diagnostics, better healthcare availability and medicine, and also a lot of awareness among the general public due to the media and the internet, but still the incidence of heart disease and even other diseases still tends to increase year by year. So this is a paradoxical situation, and hence the format of this program will mainly be in a form of frequently asked questions, and we shall learn more about the Universal Healing Program during the course of this session. So let us begin, and my first question will be to Dr. Manchanda. Sir, what type of symptoms should prompt one to seek immediate medical help to prevent a heart attack?
Well, the symptoms of heart attack are that a person gets chest pain in the center of the chest, which radiates to the left arm or the right arm. It lasts usually more than 10 to 15 minutes. There is a sweating, and there is also breathlessness. If a patient has severe chest pain with sweating, he must rush to the hospital as early as possible. Sometimes the symptoms are very few. There may not be pain, only a discomfort or a sweating. Patients who are diabetic may not have any symptoms at all. Silent heart attack, what is called. In such cases, they should go for a regular checkup, or even if they have a little retrosternal burning, they should go to the doctor. Many times.
So immediate medical help.
Yes.
And one unrelated thing, sir, people get angina pains and they are afraid it might result in a fatal heart attack. So what is basically chronic angina and what is unstable angina, sir?
Yeah, there are 2 types of presentations of heart disease. That is the blockage of the coronary arteries. If it suddenly occludes 100%, that is called acute coronary syndrome, which can present as unstable angina or a heart attack. That's a dangerous situation. One should rush to the hospital. The other is when the blockage is more than 70%. It develops over a period of time.
Okay.
On walking, a person gets breathless or chest pain, which is relieved immediately on rest. That is called a stable angina. Stable angina patients are quite safe, and they can be handled medically also. The research shows that they need not really get scared if the arteries are blocked. They can be managed very well with the medical therapy and the Universal Healing Program.
Thank you. Next question to Dr. Balakrishnan. When should one go for angiography in coronary artery diseases?
This is a subject which has been much studied. In fact, textbooks have been written on indications for angiography over the years. Patients presenting with typical angina, for instance, certainly in today's world of 2018, in most places in the world, if you have documented angina, and especially if other tests, including a stress test, shows there is evidence of lack of blood supply which corresponds with the chest pain, I would think an angiogram is indicated. Increasingly now, there is a trend towards doing angiograms even in the middle of the night when somebody presents with features suggesting a heart attack, because as Dr. Manchanda said, amongst the strongest evidences for any kind of angioplasty or stenting in coronary artery disease is in patients with acute heart attacks, where it actually can be truly life-saving and muscle-saving. So angiograms are by and large done. But having said that, in a country like India, where such a high incidence and prevalence of heart disease exists, and so many atypical presentations are possible. Patients, as you said, may or may not have chest pain, especially if they're diabetics. The symptoms can be very vague. Very often, in a practical sense, angiograms are being advised just to rule out heart disease and to allay the tension and worry on the part of the patients as well.
Okay. And another question to you, sir. Is bypass surgery always required to treat multiple blocks in a coronary artery?
No, I don't think so. As I said, a lot of these questions were asked 30 years ago, and the answers are still coming out. What is the exact role of bypass surgery in triple vessel disease? And to a large extent, I would say the findings of, say, the so-called historic CAS study still hold true. In certain categories of patients, they have been shown very demonstrably to have a long-term beneficial effect. Patients with depressed or decreased pumping action of the heart along with multiple blocks. Patients with blockage of the origin of the artery called left main. It's like blocking the Ganga at Gangotri, for instance. Patients with associated valvular disease, which is very severe. These are non-controversial indications for any kind of revascularization. Chronic stable angina or just the mere presence of some blockages in the artery, I'm not at all convinced necessarily needs an operation.
Thank you, sir. Now we'll move over to Dr. Ramesh Kapadia, who will be talking more about the universal program. He will be giving us more details, but I'll just point out that the main objectives of the universal healing program are to reduce the fear of heart disease. Number two, to make the heart treatment more affordable to the common man. And thirdly, to encourage primary prevention of heart diseases. Dr. Kapadia, is universal healing program an alternative to modern medical therapy of coronary heart disease?
No, not at all, not at all. My name has been associated with universal healing program all over, but my faith in regular allopathic treatment is increasing every day, and I'm basically a conventional cardiologist, and I use medications, and whenever surgery is required, I recommend that. Universal healing program is added about 26 years ago to increase the efficiency of our routine approach, and it deals with the stress management, which is a very important cause of increasing incidence of coronary heart disease.
Now, what made you introduce the universal health program in your practice? And to add, what are the benefits of UHP?
Well, I introduced it in exactly on October 2, 1991, and this program was actually came up in complete perspective and a very clear perspective after seeing the program of Dr. Dean Ornish in the United States. And he had been conducting that program with coronary heart disease patients for about 12 years when I met him in 1991. And I was impressed with his 40 patients who had triple vessel disease, and they were recommended bypass surgery, but they did not go for bypass surgery, and continued the medical treatment and all the disciplines of the medical treatment, and added this program for stress management, and they were all symptom free. But the important thing is that the universal healing program has got a great role in increasing the efficiency of the medical treatment. It is not separate from it. And the universal healing program is the name which has been given as a universal, but the programs like universal healing program are now a regular medical curriculum in large number of institutions in USA. Universal healing program is not a stamp of Dr. Kapadia. It is a stress management program. Now I'll tell you very briefly why I said universal healing program.
Okay.
When I started the program in 1991, I started for coronary heart disease. And I said to them that continue medical treatment and learn the art of relaxation like Shavasana and meditation as taught in this program. They did it. And within 6 weeks of practicing the program, they said that I asked them to continue the same medical treatment. And then they said that with the same medical treatment, after practicing this program, we find little bit more relief in our symptoms. But their spouses came and told me that the patient now is less angry and less hostile and is more relaxed. So I thought that it is not only curing or helping the coronary arteries, but it is curing the whole individual. So I said when it is affecting the whole individual, I suddenly thought of the name. It is a Healing the Society, so Universal Healing Program. Yeah. That's how the whole name came up. And now it is a Universal Healing Program, UHP.
Okay, so now though the word healing is there, but what you say, it basically helps a lot in the prevention of heart disease and the lifestyle management. A little technical question in medical side from a patient, that what is the role of the non-invasive test of coronary calcium score to help in the prevention of heart disease?
Very, very important question. As doctor mentioned, the surgeon mentioned, that in certain cases where we feel that the patient might have a coronary disease, in early cases and in primary prevention, and especially with a family history of coronary heart disease or a familial cause of coronary heart disease, like in our family, all of us, about 26 members, we don't have any other illness at all. We all get heart attack by the time we turn 60. And out of 24, 21 got the heart attack. So such people and the other family history people, and if we suspect that the coronary arteries may be involved, we can do a very innocent, without any injection of contrast media, a test which is known as coronary calcium score, and this gives us an idea what is the state of coronary arteries, or is there any development of plaque formation in the artery. It gives a rough idea, but it definitely helps. So it is very useful in primary prevention.
Can you tell us, Kapadia, a little more about the plaque formation before we move over to the other questions?
Now, it's a very technical question for the lay audience, but however, people think that the arteries get blocked and completely blocked all of a sudden, but actually a very thin plaque is formed in the coronary arteries by the culprit cholesterol LDL.
Okay.
And then for various reasons, during stress, during rise of blood pressure, or any other conditions which can lead to the rupture of that plaque, slight bleeding occurs in the wall of the coronary arteries.
Okay.
And as soon as the bleeding occurs, the platelets in the blood try to stop that bleeding. In the process, it does not only stops the bleeding in the wall of the coronary artery, but actually it produces a clot in the whole coronary artery. And therefore, you get suddenly heart attack when that happens.
Okay. Dr. Manchanda, please. Is angioplasty always required for the block in coronary artery, and when is it absolutely necessary?
Well, the question has been partly answered by the surgeon. Yeah. It is absolutely necessary if a person gets, say, heart attack, and he should reach the hospital within 12 hours because angioplasty is needed. During a heart attack, the artery is completely blocked. It has to be opened up because the heart can get damaged. The second indication is that if a person is having angina which is not controllable by the usual methods, by the optimal medical therapy, that means as you heard, it is called as universal healing program. It's also called holistic. Holistic means joining the ancient with the present system, which I have been also using. I call it a yoga reversal heart disease method. And in the Western, it's called the integrative medicine now, integrative cardiology, combining the ancient system with the modern, and the results are much better. So if a person has angina which is not controllable, stable angina, I mean, it is not controllable by this optimal therapy, which very few people are, then angiography is needed. As the surgeon also said, if a patient is undergoing, say, a valve replacement like aortic valve, even angiography is needed at that time. So angiography is mostly needed in heart attacks and sometimes in patients who have stable angina, who cannot be controlled on medicines.
Yeah. Thank you. Dr. Balkrishnan, please. Very often there is a difference of opinion regarding the management of heart disease, like one doctor advises conservative approach and the other advises intervention. And this causes great confusion in the patient. Would you suggest how to solve this problem, or for the common man, the family gets confused and all that?
It's not an easy question to answer. Even for each of us, I'm sure Dr. Manchanda, my opinion today is different from what it was 10 years ago.
Okay.
Sometimes I think the longer you practice, the less you know, or the less you think you know. I mean, some of the patients who I predicted will die within 6 months with severe disease are now well after 15 years. So it's work in progress. Having said that, as I said, there's some categories where there is very little doubt about the need for intervention. As I said, acute heart attacks, tight origin stenosis of the left main, and so on and so forth, or patients with decreased heart pumping action in the presence of severe blockages. About that, there is very little doubt that there is a benefit in revascularization of some kind. In patients with mere presence of blockages in arteries visible on an angiogram, especially modest blockages, you have to also got to understand that a lot of angiograms are images on a two-dimensional plane.
Okay.
We just look at irregularities in the vessel lumen on a flat screen, and on that basis we assume that the blockages are causing physiological narrowing. In fact, now there has been attempts to make it more scientific by putting special catheters to measure the degree of droppages and flow across those blockages. But each of these interventions involves effort, money, so we also live in a world where constantly we are battling with cost. So to answer that question, I would say that in a patient with relatively few symptoms of ischemia in terms of angina and with a preserved ventricular function and a stable coronary artery disease, medical treatment I think might work just as well.
Thank
I'd
you.
like to add.
Yes, I would like to ask you your views on the same thing,
Yeah,
sir.
you see, many patients come and tell us that one doctor has told us get angioplasty, other has do a bypass surgery, and third has said medical therapy. I think that's why there is a heart team approach is there now. There are certain cases there is something called a syntax. Doctors know that, which is a lesion which can be easily corrected by angioplasty, which can be corrected by bypass, etc. For example, a diabetic bypass is definitely better than angioplasty. But there is a heart team approach these days. Surgeons are there, the cardiologists are there, and then they discuss with the patient. Both can be done. It is your choice. Some patients don't want a scar, so they will go for angioplasty, etc. But I think the important thing is that some patients are done unnecessary. That is very, very important. They are seeing the blockages, they are being treated. If they are not having much symptoms, if they have stable angina, if their stress test does not show much, they can be managed medically also. So I think the best way to solve this problem is every hospital should have a heart team approach. Both the cardiologists, the interventionists, as well as the surgeon should sit across and then decide with the patient, because certain advantages are there, certain disadvantages are both the procedures and all.
Yeah. Wonderful. So we are trying to talk of a common platform where you have like a cardiologist and then an interventional cardiologist and also a surgeon.
They are there in most of the good hospitals.
Yeah. So your views on this, Dr. Kapadia?
I would like to mention one thing. that now that I'm in practice for last 54 years, the first 25 years of my practice, when I was practicing as a very busy cardiologist, there was no angiography or angioplasty in India. And when I learned cardiology in USA and in UK, and did my MRCP in 1960, at that time also there was no angiography or angioplasty in UK as well. And our experience is that large number of patients who survived the heart attack, I was called to see the patient only who survived the heart attack. So when I saw the patients who had survived the heart attack, then my experience tells me that large majority, I think probably all of them, with only few exceptions, they lived well, and when after recovering from heart attack, say about 6 weeks of rest, they really could go back to their own working. So much so that in 1978, and I started practice in 1965, I had 200 patients coming to me for follow-up who said, "Doctor, thank God I had a heart attack. I'm better than before."
Okay.
And I read one paper on 200 patients saying better than before in 1978, when Mr. Morarji Desai was the Prime Minister, and got a conference in Mumbai. And really, I was also amazed. And my all experience in UK and all that is that large majority of the patients who become, who survive the heart attack and then become stable, if they are treated with and now we have got a medical treatment which is extremely effective. Let me tell you that I'm not at all against bypass surgery or angioplasty, because my son is now a very prominent cardiologist, interventional cardiologist at Cleveland Clinic, which is a very famous clinic in USA. And I got my own brother, younger brother, operated by Dunton Cooley for bypass surgery because his ejection fraction fell to 30 and he had a very diffuse disease. And I got him operated there. And after operation, his ejection fraction came 45. And then he lived for 15 years, very active life. So that's not the point. But I have now a large number of patients. I'm very lucky that I see every day people coming for second opinion for last 20 years. And they come for second opinion because they are well and they have been advised. And when they come to my clinic after about a month or two of appointment afterwards, and then waiting in my clinic for 4 hours, and when I find them well and their ejection fraction is 40, and now the Braunwald, the recent textbook of medicine, says that if the ejection fraction is 40 or above, then there is no survival benefit by bypass surgery. There is no. There might be a quality of life benefit, but not a survival benefit once it is there. So I think that the medical treatment, which is now absolutely excellent in every way, and the reassurance will play a lot of role in treating large number of patients without expensive intervention. And I see the scene in the United States where I go every year for the last 30, 40 years, that the rate of bypass surgery is coming down. I don't know what my colleague here, the surgeon, would say. The rate is coming down, the bypass surgery. And even, as he said, the primary angioplasty, where actual pain occurs and you reach the proper place in 4 to 6 hours, then of course angioplasty is life-saving and it is heart-saving. It saves the heart muscle. But routine angioplasty after finding out the blocks is not necessary in large number of patients, especially when the people realize I've got a 90% block, I've got a 95%, I've got 80%. But when the blocks are more than 70% or 80%, in that block you can hardly get a heart attack. Okay. You get a heart attack when the arteries are less than 40% block or normal artery. That you get a heart attack. The other arteries which are blocked more than that, you get an angina, which is a stable angina, which can be treated effectively.
Okay, thank you, sir. Welcome viewers to this second episode on the program of primary prevention of heart disease and the role of Universal Healing Program, properly known as UHP. We have with us today a panel of highly distinguished medical practitioners, all of them cardiologists, who will be sharing their thoughts on prevention of heart disease and other related issues.
Primary angioplasty has really decreased the mortality. Earlier 15 out of 100 used to die. Now less than 4% die. So there is a big advance in the management of so-called heart attacks. And as he said rightly, that if a person of heart attacks comes to the hospital within first 12 hours, he must have an angioplasty. He must have an angiography and an angioplasty. That saves life. But otherwise, if a patient is having stable angina, if he has survived it after a few months, if he has blocked artery, that is not likely to cause any problem because that's a stable plaque. He said the myth should really go that if I have 90% block, I will get a heart attack. The truth is the other way. Large number of studies are there. People who have 30, 40% blockage, they are likely to get. The reason is the type of plaque or the type of deposition is called unstable. They have a very thin layer of so-called fibrous tissue and a lot of fat is there, cholesterol is there. Such things can break up. But a person who is having 90% with stable angina, it is a very thick plaque. There is a lot of fibrous tissue, very little cholesterol inside. Such plaques are stable. Even if they progress, there are no symptoms. I remember doing angioplasty long back when I started. I saw a couple of patients. We never used to do at the same time, 90%, 95%. When I did it after 3 days, the artery was 100%. So we asked the patient, did you have any pain? No. The reason is if it is slowly increasing blockage, even 100%, they are natural bypasses, which the nature makes it. In a heart attack, there is no time to make these natural bypasses. So a 90% artery in a stable angina is quite safe. Please remember that it is a 30-40% which doctors ignore. You should not ignore it. In those cases, intensive medical therapy with the alternative system like the Universal Healing Program or yoga meditation is going to help very much, because we have evidence with our research that unstable plaques possibly become stable. When we did this study, we found that the regression, the blockages regress very slightly, 3 to 5%, but the heart attacks reduced by 50%. Now we couldn't explain it. The only way to explain was that the unstable plaque becomes stable. So one of the greatest advantage of this Universal Heart Health Healing Program and the yoga meditation is that although the plaques may not regress too much, but they become stable, and that's why these patients will not get heart attacks.
Thank you, sir. Next question to Dr. Balakrishnan. Recent observations are that 80 to 90% of bypass surgery and angioplasty are unnecessary. This is sort of a view. What is your response to this observation?
I'm not sure about the validity of such statements. First of all, these are procedures which are done in huge numbers all over the world.
Okay.
So for you to generalize as a passing sweeping statement,
okay,
where do you get such data from? Is it a hospital specific data, state specific data, country specific data? So that may or may not be true. Having said that, it is possible that some of the procedures that we have been advocating retrospectively may or may not be, and this is true for a whole lot of procedures worldwide historically. If you look at literature from 1930s, rhinopexy or visceropexy used to be a very common operation. You know, they used to think that some of the pains in the loins was because of visceroptosis. That means the organs used to float, you know, all kinds of.
Okay.
So having said that, in a given case, it's hard to say whether that particular, even if it was done in the best of intentions and faith, whether that patient would have had as good an outcome without the procedure or not. It's hard to tell. But by and large, our understanding of these procedures is better now. And as I said, with increasingly more sophisticated, better medical treatment being available, and especially if we follow better guidelines and better lifestyle modifications. I agree with Dr. Kapadia that actually there are some interesting studies in the number of cath labs in the United States which practice angioplasty actually has come down.
Interesting.
And I'll give you another study. If you look at the incidence of coronary artery disease, I mean, this is to slightly digress. The coronary plaques don't start at the age of 60. They start as young as 15 or 20. And the first evidence we had was in autopsy studies on young victims of the Korean War, 1951. The Journal of American Medical Association for the first time produced an autopsy series where they showed coronary plaques in people as young as 23 or 24. And the incidence roughly was around 30-odd%. I did a study in our city in Chennai about 10 years ago. We published it, where we looked at road traffic accident victims up to the age of 30. We looked at 30 autopsy studies and looked at and they died of an accident, so they didn't clearly die of a heart attack. And we found 35% of the heart showed significant plaques. 4 of them had what we call severe triple vessel disease. But what was interesting was all of them had, 30% had inflammatory infiltrates with neutrophils. So a normal coronary artery has no business to have white cells in it. So it brings to question the role of atmospheric pollution, toxic fumes, diesel adulteration, and all kinds of other things. But the same JAMA actually published 5 years ago, compared to the historic Korean study with more aggressive advocacy of control of blood pressure, salt intake, and other exercise, and so on and so forth. The autopsy evidence of prevalence of coronary artery disease is less than what was shown in 1950. So as the esteemed panelists have shown, prevention has a great role to play in this.
Yeah, but these are very interesting facts you pointed out, sir. Thank you very much.
But this is also true that the heart disease is increasing in the young age.
Yes.
We do angioplasty
in our population.
In our population.
In our population.
But not in
Yes.
the Western population.
This is because we are having very unhealthy lifestyles.
Yes.
And that is very important to say.
Yeah.
For primary prevention, a proper diet, regular exercise,
we will be
no stress.
coming to that very shortly,
because
of course,
because
that's a
that is most
key
important.
component.
The stress is a factor which is a very, very important factor. I have
Yes.
seen in young executives who get heart attacks.
True.
It's occurring in 20s. I never used to see it about 40 years back.
That's
It was
very true,
60
sir,
years true.
in lots of cases. Moving back to Dr. Kapadia, can you explain us the key components very briefly about the Universal Healing Program and the significance of each component of the UHP, very briefly?
Well, we say the 5 components.
5
the
components,
first is
yes.
the diet, the advice regarding the diet. And then the light stretching and regular walking on level for about 30-40 minutes daily. And light stretching and relaxation exercises leading to progressive deep relaxation, which we call Shavasana. And meditation and visual imagery. And lastly, the most important, group discussion with sharing of feelings. So these 5 components we added, and we had an opportunity to deal with thousands of patients, thousands, because gradually, because we put with the whole program for the people, so there was no fee attached to it to come to the program, and we put the whole thing on internet and various media completely free, and then we had the occasion to see the feedback from people who were continuing the medical treatment and who were doing the program regularly for about 6 weeks or 3 months or 4 months, and they could give up tobacco. Tobacco habit is the worst habit, and which will increase the incidence, and it really does not allow any treatment to be effective, whether it is angioplasty, bypass surgery, or medical treatment. And tobacco habit is very difficult to give up.
Yes.
And that we have found that if the regular practice of Shavasana and meditation as shown, very simply shown and very effectively, because it was directed by Swami Sachidanandji, who believed that he had a challenge to teach that technique to the hippies and the Americans who would not like to, all that usual way of teaching this yoga. So he did it very simply, and I was very happy to see that in the Americans who are very busy and who never had a knowledge of yoga at all, but they could practice it very well as simply shown, and that we introduced. And with that simple practice of Savasana and meditation, I found that 80% of the people could give up tobacco after practicing it for about 6 months. So that was a great achievement, I thought. And also, somehow or other, that the medical treatment that they were taking became more effective.
Thank you. So that is how meditation and savasana help in the treatment of heart disease. Now, could you comment on how stress and anger damage the heart? What do you suggest to control them, even if they are not heart patients, to say?
Well, stress is, if you have an acute stress, it leads to narrowing of the coronary arteries. You see, the whole subject of coronary heart disease is shrouded by two things. One is the regular block by the plaques, but actually the arteries are very sensitive, and therefore any emotion and acute stress can lead to the narrowing of the coronary arteries almost 100% quickly. Not only that, the circulating blood can become thick 1,000 times when you get a stress or an anger which is uncontrolled. And I have seen my patients who have been doing excellent, in medical treatment and usual relaxation technique, but in a burst of anger, which they could not control for various reasons, they have died. So stress is a very important factor in starting the symptoms, in progress of the disease, and the ultimate effect of any treatment that you are taking, whether it's a medical treatment or the medical treatment helped by angioplasty or bypass surgery. So stress is a very important factor to be dealt with when you are dealing with the patient of coronary heart disease. Therefore, the art of communication by the cardiologist to the patient, I think, is of great importance, which I learnt in my early days in UK and also in USA, where I was a chief resident in cardiology with the 5 medical schools attached to it, and at that time there was no angiography or angioplasty. And the way in which they were treated, and way in which, especially in UK, where there was a heyday in UK, where health service was at its peak, and there was no expense involved, and the consultants were paid so well that they had no worry about what they will get the fee. And in that atmosphere, when I studied, I became doctor only in UK. I never did anything here. So there I found that was golden years. I found the method that by talking to the patient in the right spirit and encouraging the right spirit has a lot to do with this sensitive problem of coronary heart disease. Coronary heart disease is not only physical, as now it has been established by various studies in narrowing of this and narrowing of that, but I think it is the main thing is that the whole approach. My consultant, when I did my MRCP in cardiology and I was coming home, he said only one advice, and he was a very important person in UK. He said to me, Dr. Kapadia, now you are a consultant. When you go home, you will be seeing the heart patients not on the day when he gets the heart attack, but you will be seeing him after 3 days or 4 days or after a week. And if he's alive, then you will see him. Then remember that he's going to be alive.
Wonderful.
And treat him like that. And that approach I applied right from the day one in 1965. And I'm very happy and to some extent proud to tell you that I never lost anyone. And at that time in Ahmedabad, city like Ahmedabad, we had no private hospitals. We had only 3 corporation hospitals. And we had to admit people only in the corporate hospitals and in special rooms sometimes. But large majority whom I treated from 65 to 85 or 86, large majority, I treated them if their homes were good at home.
Okay.
Once I took a patient for considered bypass surgery to Denton Cooley, one of my wealthy patients, and when he asked me, Dr. Kapadia, I heard a lot about you. How do you treat your heart patients? You know that. So when I told him that I treat him at home, a relaxing home, he just stood up in the chair and he said that how can you treat the person with heart attack at home? But then there were homes at that time. Now there are no homes, of course.
No, so it's very important that the communication of the doctor and the patient, in all cases. Now,
I'd like to add a little bit in the stress. See,
please.
A lot of scientific research has been done how the stress can cause heart disease, not only heart disease, diabetes, high blood pressure also. There are 2 types of stresses, as you said. One is acute stress. For example, a person suddenly becomes angry. Yeah. Not only he can damage his heart, there is something called heart failure. It's a cardiomyopathy called stress-induced cardiomyopathy. Yeah. He can go into heart failure, symptom like heart attack, immediately. A person who gets acutely angry, I have seen his heart rate may become irregular. He may die suddenly. A person may go into heart failure. A person, as he said, may suddenly have a heart attack. Also, the artery which is already not partially blocked, it can completely block. So that is one thing. But what is the research? Research shows when we are angry, or we have ego, or we have hostility, we have jealousy, what happens is our two systems get bad. One is the so-called the hypophysis pituitary adrenal axis. This is a brain. There is an organ in the brain, and the other is the autonomic nervous system. When the brain is affected, the hypophysis system, the whole endocrine system, there are a lot of catecholamines, there are bad hormones which are, and these bad hormones with the abnormal nervous system, they interact in such a way that ultimately inflammation and oxidative stress is produced. That inflammation damages the arteries, damages the pancreas, damages and causes heart attack, causes diabetes, and causes even sudden death.
Your view on this, please.
See, it's interesting. In fact, this is pretty recent. I'll add my own bit to this. The question you asked actually is interesting. How does stress cause? I mean, the simpler the question, more profound it is. It's not easy to answer, because it's one thing to say anecdotally stress causes heart attacks, blah blah blah. But how? So there is a lot of recent study, and this came out of, as you know, one of the fastest growing areas of heart failure is use of mechanical heart pumps, so-called left ventricular assist devices, which use the pumps don't produce a pulse; they're continuous flow pumps. So what now they have shown is increased amount of catecholamines. Dr. Manchanda mentioned about stress releases hormones. Increased amount of catecholamines almost also seem to affect the mechanical properties of the vessels. The elasticity comes down and they become stiffer. So it's a vicious cycle. The less elastic your blood vessels are, higher your blood pressure is and lower your pulse pressure is. They become less pulsatile, and that starts a vicious cycle. And so there is a direct physical effect of stress on your vessels. It is, apart from spasm, there is a chronic change which takes place in the mechanical properties. So it makes sense for all of us to control whether anger or stress levels. Having said that, it's easier to say it rather than to practice it, I suppose.
Dr. Manchanda, a question which is of your pet research topic. There is a common belief that blockages in the arteries cannot be reversed. Is the reversal of blockages at all possible?
Yes, it is possible. There are many methods of reversing it. There are drugs which have been shown, statins which in high dose have been shown to reverse only slightly. But early stage it is possible to research. We have shown two studies we have done. One, the early blockages, when the artery has started to become thick. This happens in a metabolic syndrome. You know, there is a disease which Indians have. They are very fat in the abdomen. They have what is called metabolic syndrome. They may not be overweight, but their tummy is very bulging outside, and they have also high cholesterol, high blood pressure. Such people are very prone to get heart attack as well as diabetes. Now, in such people, the arteries have got thickened, and we have done yoga meditation, a part of universal healing program, and we have shown reversal is possible in those completely. Advanced disease also, there are 4 studies including Dean Ornish and ours. We have shown it is possible to regress it by 4 or 5 or 6%. So there are 3 studies using different methods. Meditation, Raj Yoga, we have used a Pariksha meditation, Dean Ornish use. Any system you use, ultimately the stress is reduced, and it is possible to reduce it. But as I said, although the reduction is small, 4 to 5%, the progression is not there. If you control studies, the progression. Secondly, these people have very little heart attack. Mortality is reduced by 30%. By 4 or 5 should not cause that. So what is said is that these unstable plaques become stable. So this yoga meditation helps in stabilizing the plaque. So regression may not be too much. In the advanced disease, early stage, yes, it's possible. So it is possible to regress it partially, but it is important to change the morphology of the plaque so that heart attacks don't occur, the people don't die.
Okay. Now, one more thing which you are specializing in. What is the proper diet for patients of coronary heart disease?
Yes, this is a very difficult question because a lot of controversies. I tell my patient, doctor, you say sometimes ghee is good, sometimes ghee is bad and all that thing. So what is this happening? There's complete confusion going on.
Yes.
But I'll just tell you, the scientifically proven 4 things are there now. One is we should not use trans fats, these hydrogenated oils,
Yes.
which halwais use it again and again. Secondly, these trans fats are produced by reheating the oil again and again and again. The second thing is, which is definitely proven, is we should avoid refined things. Jaggery, gur has been changed into sugar. Sugar is the new culprit now. Similarly, this white bread should be avoided because we have changed wheat into this maida, which is dangerous. The third thing, rice should not be refined. And fourthly, the oil should not be refined, because refining we are spoiling it. So first is trans fats, the other is the sugar or the refined thing. The third, which is come out, is very clearly that fruits and vegetables should be taken in plenty. If you take it 3-4 times, fruits and nuts. Nuts are extremely good, including cashew nuts. You will be surprised. My patients ask me, will it increase cholesterol? No, it decreases. A lot of studies are there that these nuts have fat, but this is a good fat. So nuts are extremely protective, and you should take less of salt. So these 4 things you follow, this is the ideal thing. You should take lots of fruits, vegetables. Again, I will say, avoid so-called the trans fats, that is the hydrogenated oils, and use lots of fats. There was a lot of controversy whether we should take cholesterol or saturated fats. A huge study has been done, pure trial, which shows there is no need of limiting the fats. A good oil is, of course, a mustard oil, which is unrefined because it is the highest, but ghee is extremely good. We have been telling our patients not to take ghee. Their HDL has come down. Now ghee is saturated fats. There is a lot of meta-analysis shown that saturated fats is not bad. So ghee and coconut oil are extremely good. Actually, they are very good for Indian conditions because we fry the things, and these so-called refined oils, they get detoxify and all. So ghee is good for us. The nuts are good, the fruits are good, but the bad thing is that salt, sugar, and trans fats.
Thank you, because that's an important clarification. Dr. Balakrishnan, it's a very common question, basic question, but we would like to hear it from the surgeon's mouth. Please explain what harm smoking does, and can you suggest the best way to give up this habit?
The best way to give up the habit is to not start it.
Okay, interesting.
And frankly, I think there's a lot of effort being done in this country. In fact, I travel a lot, I'm sure like all of you do. The incidence of or the amount of smoking which is done in public places in this country actually has come down substantially. At least in airports and in restaurants, smoking is not allowed. Whereas if you go to even France, smoking is everywhere. In Middle East is rampant. Smoking is injurious not just to coronary artery; it's injurious to blood vessels. In fact, one of the major impact of smoking is in peripheral vascular disease. You get gangrene, you get amputated legs, you get strokes. So smoking, the nicotine content in smokes is injurious to blood vessels. It causes, apart from heart attacks and strokes, it causes cancer of very major impact on lung cancer. Passive smoking is as dangerous. So smoking, you not only kill yourself, you kill your wife and children as well. So some of the efforts which have been taken is the warnings in cigarette packets, and even in films and movies, whenever the hero lights up, to have a small advisory that smoking causes cancer. In the olden days, I remember whether James Bond or Rajnikant or any of the heroes, one young woman is screaming, falling down from a mountain, he'll light up a cigarette and with one hand, so a feeling of, or even this camel or this cowboys wearing Stetson hats and smoking. So it created an aura of glamour and romance around smoking.
It was glamorous,
which killed a generation of people all over the world. Fortunately, it's coming down, but still, I think the incidence of smoking in India is coming down. Though there are other smokes which are being spewed by automobiles which are not necessarily being banned. I think that's maybe he should address it at some point.
There are 2 points I would like to say in smoking. Although smoking is coming down, and I agree with him, awareness is there. But chewing of tobacco, tobacco is increasing in our country. This is very unfortunate because chewing tobacco is much worse than that. Not only it causes heart disease, causes cancer of the throat, which is the highest in our country. So I think important thing is that
the ads for gutka and all that.
Yes,
should be
absolutely.
Yes.
Because that is a very, very non-inhaled smoke is extremely dangerous, and this has been going on increasing. We should really do something about it. One of the best methods of giving up is meditation. I have tried all methods. There are, there are tablets, there are patches, there are tablets. But I have found if you can teach a person meditation, because what is meditation after all? According to the ancient yoga text,
Yeah.
we are not the only body. We have something called mind and consciousness. Mind is the lower mind, and the lower mind has so-called hate and love, and it has duality. The higher mind does not have. The yoga takes you to the higher mind, and the lower mind really causes all these problems. So if you can control the mind, I always say heart disease starts in the mind actually. The reason why we have failed to tackle it in spite of all the advances is we have not really addressed the mind. Because I ask my patient, why don't you exercise? He says, doctor, I want to go. I get up in the morning, but my mind says, don't go today. It is raining, it's yesterday you had a late night, and tomorrow some other excuse. He goes to a party, he knows that bad food is there. He knows it's bad, but his mind says, take it today, not tomorrow. Tomorrow never comes. Smoking, he says smoking is bad, but my mind says 1 or 2 cigarettes doesn't matter. So it is the mind control. Who creates these thoughts? So, and this is what we have found, universal system, and our system of meditation has shown that we make the mind strong. The moment mind is strong, it is given up. We run also courses like he does meditation, and during that 5-6 residential course, they never ask for tobacco. They never ask for it. So it is possible to reduce it by meditation.
Oh, that's interesting. So essentially, it's meditation that leads to mind control. It not only helps smoking, but so any habits. Now, the last question in today's episode, Dr. Balakrishnan, please express your view on chelation therapy. Now, there are a lot of things in the media. See, why I ask this question? It's a medical term. But as I said, there are a lot of things in the media, so people get confused. So that's why we took this question today.
I know we have a couple of centers close to the hospital which claim to reverse coronary artery disease. I have not found any scientific evidence that they necessarily do anything worthwhile.
Yeah, it started, you see, this is a method which is used for these taking out the poisonous material like lead, mercury, etc. It is established, accepted.
But not in
now some people thought that the calcium of the coronary arteries will go. It has been going for 35 years. All the trials have been negative. There is only one positive trial, which is also very weakly positive. And that's why hard trials are going on. But at present, it's completely useless. There could be side effects also at the level where you are giving and all. So I think as far as today's scientific knowledge, chelation therapy is useless.
Thank you. To conclude, I feel this session has been a great take-home for all of our viewers, and all these 3 panelists, these experts, have clarified a lot of issues regarding heart diseases and its prevention, and which is very important for our nation, especially for the young generation. I'm grateful to these 3 panelists, Dr. Kapadia, Dr. Manchanda, and Dr. Balakrishnan, for sparing their time and resolving a lot of common issues which is in the minds of the common man. And we also wish that Dr. Kapadia's Universal Healing Program will go a long way and spread across the country to help not only in the prevention of heart disease, but the overall well-being of an individual. Thank you, viewers. Welcome, viewers, to this program on primary prevention of heart disease and the role of Universal Healing Program, popularly known as UHP. According to reports from the World Health Organization, coronary heart disease is the #1 problem among the young all over the world. Incidence of heart disease in India is probably the highest in the world amongst different countries. We have with us today a panel of experts, all practicing cardiologists, who will share their thoughts on primary prevention of heart disease and other related issues. And I will introduce this trio of highly accomplished professionals to you. We have with us today Dr. Ramesh Kapadia, a consulting cardiologist based in Ahmedabad with over 5 decades of experience. He is passionate about prevention of heart disease, and he got inspired by Dr. Larry Doshi and Dr. Dean Ornish, both from the United States, to start the Universal Healing Program more than 26 years ago. He combines the wisdom of the East and the scientific knowledge of the West. We also have with us today Dr. Subhashchandra Manchanda, who is a cardiologist and a senior consultant at the Sir Gangaram Hospital in New Delhi. And prior to that, He was the professor and head of department at the All India Medical Institute of Medical Sciences, and he has been practicing for over 4 decades, and he has done a lot of research in the reversal of heart disease and preventive cardiology. Finally, we have with us Dr. K.R. Balakrishnan, Director, Cardiac Sciences and Chief Cardiothoracic and Transplant Surgeon at the Fortis Mallar Hospital in Chennai. He too has over 3 decades of experience in this field, and he is considered one of the best heart transplant surgeons in India and an expert on the management of end-stage heart failure. I welcome all 3 panelists today. And viewers, it's a paradoxical situation that in spite of great advances in medical research, better diagnostics, better availability of healthcare and medicine, and a lot of awareness through the media as well as the internet, the incidences of heart disease, not only heart disease, but the other diseases have increased over the years. And hence, the format of this program will continue in a form of the frequently asked questions by patients and the common man. So let's begin with our questions. And this time we'll begin with Dr. Ramesh Kapadia. What are the guidelines for primary prevention of a heart attack, sir?
Well, the primary prevention in a family actually should start right from the age of 5, when we should teach our children to play outdoors, to have the physical exercises, and then when they grow older, they again they should be taught in the proper dietetic habits, and then when they get of age, if they have a family history, or in any case, the tobacco use of any kind, chewing or smoking, is deleterious. That has to be taught right from the school days. So normally our thing is that the chubby children with less and less activity and avoid, and as our friend doctor said, that now there are less and less facilities for children to play, and they try to be indoors with all the various games on the computer or on the internet. So we have really a great problem now in the modern world to prevent the disease right from the childhood.
Dr. Balakrishnan, your views on that?
Childhood obesity actually is a problem.
Yes.
30 years ago when we were children, I think it was unheard of. And now, also commercials on TV, they advertise so much of junk food.
Yes.
You go to a movie hall, they give combo packs of big sodas which are full of processed sugar, big popcorns with so much salt in it.
Big helpings.
Big helpings. And increasingly, as you said, we are playing virtual games, but we live in the real world. Our health is not virtual, it's real. So the amount of exercise that children get, most of us used to walk to school or take a bicycle.
True.
Now they get dropped, and the public spaces actually have been taken up in big urban sprawling cities by all kinds of construction. The amount of places available for children to just play is shrinking, and I think that's very, very sad and dangerous. I can't imagine what this reality will be 15, 20 years from now in these big cities unless we reimagine our cities and take drastic steps today.
So basically prevention has to start from an early stage, as Dr. Kapadia said, and this other common issue, which is not only talking about heart disease but the well-being in general, has to be addressed by the urban authorities for the general well-being, because it cannot be only advised by medical practitioner or a few people, but
and
at the macro level.
Our elections also have to focus on things which matter rather than things which don't matter. I mean, I don't wish to specify what, but if you look at the American elections,
yes,
where the 18% of their GDP is spent on health, of a multi-trillion-dollar economy, very often the debates about healthcare. Here, our 1.5% GDP on health, and we discuss things which are totally irrelevant to our day-to-day life.
Correct.
True.
Is that true? I mean, it's appalling to me.
So that's a very important input for the prevention of any disease. Anything to add, sir?
Yeah, you see, what is very disturbing is that in our central cabinet, the health portfolio is not given at all any importance. Health and education, which are most important, are relegated to the last person. If a very able IAS officer has to work with the health ministry, and somebody has to work with the foreign ministry, then he would think that fellow is a much better place than what I am.
So it's the perception.
So it's the perception, and of course we have not given importance, as Doctor said, to health and education, and actually what I have noticed in the United States for last 50 years, that people care for health and education more than any foreign policies or anything like that. And the average person in the United States really vote for his own health and education and has his daily life,
In fact, the real estate value of a locality to a large extent is dictated by the quality of schools in the locality.
Quality of schools.
True.
Yeah, the social determinants are very, very important. I would agree with you. Yeah. For example, even this pollution which is occurring in the atmosphere, we are one of the worst in the whole world now.
Yes.
This pollution could be controlled by the authorities and all. Even these roadways, this noise pollution itself.
Yes.
If you have colonies around that, if there is a noisy neighborhood, it also increases heart. These are all been shown. Playgrounds have gone. I think the government could do a great too, but I think the people have to be aware of it. Only then they can. For example, bad things in the diet could be labeled. Trans fats could be labeled. It's bad. Just like cigarettes have been labeling has been done, but it's not been done on the chewing tobacco, and it could be done and all. I think the public awareness has to be there, and as he said, the locality's price should be determined by the health infrastructure that they have.
True.
So if government could maintain the parks, I think heart disease will come down, because exercise is a very important thing. Secondly, pollution could come down, noise pollution. It will, if the neighborhood is
air
also
pollution and noise pollution both.
is a very, very important thing. People who are staying near the highways where the noise pollution, they get more heart disease. And air pollution, is a very, very important factor, not only for the lung disease, but for the heart disease. 30% extra deaths are occurring because of this noise pollution.
True, sir.
I think
And
it's very
lack of playgrounds is causing quite a lot. In Delhi, there used to be a lot of cycles earlier. Yes. You hardly see a cycle. So we must really fight for the cycle tracks. It's possible in many countries. If it is there in our country, I think it will come down. Obesity, I like to just add one thing.
Please.
Is the most dangerous thing now that I see, because there is no medicine for that.
Yes.
If somebody has a high cholesterol, high blood pressure, we can treat it. And people don't think it's a disease. For example, I was going for a walk in my park, and there's a lady with a very fat child. I said, why the child is unhealthy? He said, no, he's a healthy child. The impression is that obesity is a good thing, should go.
That's also wrong perception.
Very, very bad. It's a perception should go. And this is again, I think programs like this can tell you, if your child is overweight, this is because of lack of exercise and watching too much TV.
And lack of awareness also.
Yes, if the child spends 2 hours on the computer or TV, it is like smoking 6 cigarettes now. It's been shown now.
Okay.
So the parents should be aware that if they don't make their child exercise, they are almost...
So that's a good observation. Dr. Balakrishnan, you are saying something.
I think it's also very simplistic to think that by taking one type of oil or one tablet, we can prevent anything. It's a lifestyle change.
Yeah. Yes.
And to a large extent, as I said, lifestyle is also dictated by the reality of the society we live in.
Dr. Kapadia, you are saying something.
The last thing I want to say, as I emphasize, that our policymakers, they are the politicians actually, their role. I should think that after the Prime Minister and the Home Minister, the Education Minister and the Health Minister
should be the most important.
Be the important thing. And then I tell you, it will change the whole scene. That because we have least competent person put into this thing and least important thing, and then we talk about all the hygiene and all that.
And most of our schools don't have playgrounds.
No, enlightened public could make them.
Yes.
The politicians
It
change
is
the
the
enlightened
public
public is very
awareness.
important,
Yeah.
because public will say vote on the health issues. It is very important. So
Yes,
enlightenment of the
exactly.
public is very important.
Yeah.
Okay, so coming back to our topic of heart diseases, Dr. Kapadia, what in your opinion is crucial in bringing about a successful outcome in the treatment of coronary heart disease?
Well, we have now understood coronary heart disease the causes of coronary heart disease and the treatment. And the treatment, I'm very happy to tell you that over the years has become more and more and more and more effective. And in an expert's hand, the treatment itself will make a great difference. But the way in which we give the treatment, the part of the treatment is the communication with the patient. And that communication skill we never teach in the medical schools. We are not. Again, we come back to the same subject.
Yes.
That who we give the importance of communication. In our medical schools, we never teach communication. And communication is the most important aspect between a doctor and a patient, which I found in UK and which I have been practicing all the time. And I find that the right communication will heal the most complicated patient, most complicated, the right communication. So now we have a armamentarium, has to be accommodated by the good communication, and the stress management. The stress is a part of the life now, part of the life. But that stress, all stresses are also not harmful, because it's a part of life. But how we deal with the stress.
Yes, that's more important.
Now that name is Universal Healing Program and name attached to my name and all that, that I think is unnecessary. What is important is we have to learn how we connect with all the other people. And we can connect with the other people because we have got only one thing common in all of us. Sitting here, one thing common in all of us, or rest of the universe. One common thing. Our bodies and mind, they are different with each one, and we have got different things to do. But we really forget that our body and mind, which are so important and which we live, are really alive and kept going by only one thing, and that is the breath. And the breath, the good Lord has given us that habit. Supposing if I had to talk to you only after breathing for half an hour, then the life will be miserable. But when I'm talking to you, I'm breathing and you're listening because you are breathing. So let us learn what I have learned, from this program.
Okay.
That if we learn to be one with our breath for 10 minutes twice a day,
Okay.
and to become one with the breath, we have to quieten the body and mind.
Okay.
And body and mind, you cannot quieten mind, is like a monkey. So we can quieten the body. And the mind is present in every cell of the body, as Hippocrates said, our father of medicine. So if we relax the body, then the mind will automatically relax. But it's difficult to relax the hand or relax the body. So if we can stretch it comfortably for a while, only comfortably, and then relax, the relaxation will be better. So we taught that principle of stretching and relaxation.
Yes.
And we taught one important thing in the program. We used to raise the hand in PT training in the school.
Yes.
But at that time it was a physical thing. Now, if the person can put this much hand or this much hand, we don't mind. But when he puts his hand up, he should concentrate on the muscles which are being stretched, bringing the awareness to the muscles which are being stretched and which are being relaxed. And do it twice and forget it. That way, doing it from toe to head and relaxing the whole body, the whole thing, the mind automatically relaxes.
So
and
coming
when the
back
mind,
to the Savasana,
let me complete the whole thing.
Yeah.
When the mind is relaxed like that, then you become one with your breath. And then no pranayama and no changing of the breath. The breath is going on. But we were not worried, we were not one with the breath. You become one with the breath for that time. And when you become one with the breath, you have to do this mechanically for 6 weeks, like program like this. And now we are teaching even 1 minute meditation, which we'll talk about later on. And when we are,
Okay.
But when this happens, I have found miraculous change. And normally a rickshaw driver and all that who are not pandits in yoga and on knowledge, all that, they do my program better than all the people who have a lot of knowledge about yoga, because they get confused and they get and they learn everything. And this is what I learned from that Swami Sachinanandji, who was a disciple of Dr. Sivanand Swami, who said that I was given a challenge, Dr. Kapadia, to teach the hippies meditation. Therefore, I could know how to teach them when they were clothed in any way they like and all that. And when I was successful that way, then I could know that we can. Our Bhagwa Kapdawalas, he used to say, that have done lot of injustice to yoga than anybody else.
So in short, teaching Savasana and meditation in a more systematic fashion helps in the prevention. And coming to Dr. Balakrishnan, What is the best treatment for a patient of heart attack with ejection fraction less than 30%?
It depends on whether the ejection fraction is 30% because of the heart attack in the immediate acute phase, or he already had an ejection of fraction of 30% and suffered another heart attack. Usually if the ejection fraction is 30% because of the heart attack and they've come to you within a few hours, you have to have an angiogram and have a primary angioplasty of some kind. And ejection fraction has dropped to 30% means he's possibly going to what we call cardiogenic shock. He's quite sick, and the chances of dying are very high. So after doing an angiogram and an angioplasty, or if angioplasty and angiogram are not possible, they are in a remote location away from a cath lab, you have to give clot busting drugs, some kind of thrombolysis as we call it. If immediately the ventricular function doesn't improve and it's low, then you should look at supporting the heart with other modalities like a balloon pump or something. But in any case, if the ejection fraction is 30%, we would recommend as quickly as possible to shift him to a tertiary care facility where more advanced therapy is possible.
Dr. Kapadia, there is a lot of confusion regarding interpretation of lipid profile reports. Can you explain?
Oh.
Again, because because of the media and the increased interaction among the patients, this has become a little bit over discussed or controversial.
I tell you, it's a very, very complicated or knotty issue, I tell you now, and various opinions. And during my practice of more than 5 decades, I have changed my opinion regarding lipids about 4 times. Okay. At one time, I never even requested a lipid profile test in the first 10 years of my practice. I said there's no point in doing it, And we were treating, and because I had my training in UK and USA, at that time the lipid profile was, done in just a total cholesterol or something like that.
Okay.
And then they told them LDL and HDL and everything. That difference also came up gradually. The first cholesterol lowering medication, I don't know, but both this doctor will know, it was Atormid-S. Atormid came, ICI made it, the first one. And they came so much that the BMJ journal and all that, they published that if you take it, then the cholesterol will come down and it will prevent heart attack and all that. My consultant, my teacher, he said, we'll wait, for some results to come in there. And within 6 months of introducing that Atormid-S, people became bald, they developed cataracts and all that, and the cholesterol lowering medications earned a very bad reputation. All that.
Was there an increased incidence of suicide as well? If I remember right?
That was the gemfibrozil.
Yeah. So then, you see, and to earn back that little prestige for it took a lot of time. And then when it took a lot of time, then the question came up of various type of cholesterol, and then the low density and high density lipoprotein. High density, then HDL was considered very protective, and LDL is the harmful one. Now, what stands today, according to my thinking, when I visit United States in a very, renowned institute, they give a lot of importance to LDL, and even now LDL particles, macro and micro particles. If the micro particles are large in number of LDL, then they try to stick to the wall and make the plaque, and the macro particles are not that bad. So that test of finding out macro and micro particles is a little expensive and not easy. So now what I learned from them, if the LDL cholesterol is lower than 70 or 60, then the microparticles are there and microparticles are less. Anyway, for last 10 years, I have developed great faith. I know I may be put to question, but at least I've got a large number of patients. And I feel that I have now been convinced that if I keep their LDL cholesterol below 60, then chances of recurrences are very, 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 almost nil. And lower the LDL, better the prognosis. And I have used statins in highest dose now in susceptible people.
Okay.
I use now 80 milligram of atorvastatin.
Yeah.
Of course, my experience with rosuvastatin is less because it is recent. But both are same, they tell me. But anyway, my faith in atorvastatin is so much now, which is very different one, that I take 80 milligram without having any illness at all. I have never been ill one day in my life. But I have started doing primary prevention right from the age of 60. Because my total cholesterol at the age of 28 was 310 and my LDL was 161. And my brother got a heart attack, who was only 3 years younger to me. So since then I became aware, and I did my coronary calcium score early on, and I found that I had a plaque rising in 2 of the arteries. So since that time I have started taking treatment for blood pressure and keeping my LDL cholesterol with very great effort, diet as well as 80 milligram of atorvastatin now. And another thing which is very important, and I want to tell the doctors here as well, as you know, the placebo effect. Placebo effect that something given by the good doctor, the patient gets well. But now there is a nocebo effect, and nocebo effect is prevalent in atorvastatin. People think that atorvastatin you get the muscle pains. So as soon as you give them atorvastatin, they get the muscle pain. It's so much advertised. But as a matter of fact, people who require atorvastatin, I have got ample proof that they don't get muscle pains at all. And even high dose of 80 milligram, and I am taking 80 milligram, there is no question, because I know it, I require it. And this I have given in how many patients I can see myself, about 10,000 so in last few years. All of them are on 80 milligram of atorvastatin. All of them, those who had the problem and all of them are doing well, and therefore I don't carry even a card of mine and nothing of result. But the mouth, from the word of mouth, I keep on getting the people who are getting. So I think, I don't know what these two experts have to say anything.
Yeah, we'll come to
my
that.
Practical experience.
Before we talk more on statin, we are going to talk on that.
I'll just like to clarify the LDL, which is, there's no confusion now.
Yeah, you're talking about LDL. Okay.
All the international guidelines say LDL is important.
Yes.
But for Indian guidelines and in diabetics, it's the non-HDL, which is more important, because the triglycerides are high and all these particles are taken. So non-HDL and LDL are important, and lower the LDL, better it is. In a child when he is born, it is about 30 to 40. And now the guidelines are coming that if you reduce it to 40 like a child, he will never get a heart disease. Statins are useful in certain cases, but now there are new drugs which are called PCSK9 inhibitors. And these drugs can reduce it to 20, 10, and even then there are no side effects of that. So I think I agree with him. The lower the LDL, better it is. But I think for Indians, it's better to have non-HDL, because that takes all the particles. It's a very simple test, can be done in non-fasting, and that is in the guidelines, all international guidelines. We made a guidelines, Indian guidelines for dyslipidemia, and we said these are the two important, LDL and non-HDL should be done in all cases.
Okay. So as you said, these are very important parameters, and in a country like India, where both heart disease and diabetes are prevalent in much higher numbers compared to many countries. Dr. Manchanda, can you talk about the role of aspirin in primary prevention? Because this is again a debatable question.
Yes. You see, there is no debate that it is extremely good for secondary prevention. For example, if a patient has a heart disease, angina, or has a coronary calcification or a atherosclerosis, it must be given. There is no question about it. There is lifelong, it has to be taken. Only question is the primary prevention. Should not be given routinely, because the bleeding is much more. But anybody who is at a high risk, like he said, his cholesterol is high, if you're a family history, then we will give aspirin. So in high risk cases, we give it. Diabetics who have some other risk factor, we give it, but only in high risk. For primary prevention, it has very limited role. Should not be given indiscriminately, because the side effects are much more. The bleeding can occur, although it's very rare, but it can occur and it can outweigh the benefits. So give it for primary prevention if there are risk factors like hypertension, family history, or very high cholesterol, etc.
Thank you, sir. Welcome viewers to this program on primary prevention of heart disease and the role of Universal Healing Program, popularly known as UHP. We have with us today a panel of highly distinguished medical practitioners, all of them cardiologist, who will be sharing their thoughts on prevention of heart disease and other related issues. Now Dr. Kapadia talked about statin, so we would also like to have the views of the cardiac surgeon for statin, please.
I'm not sure I can add much more than what they've spoken, but we give statins even in patients who have had a transplant, for instance.
Okay.
We have a fair amount of transplanted hearts can also develop blocks, though the mechanism of coronary artery disease in a new heart which has been transplanted is different. It's in fact the commonest reason why transplanted hearts don't last forever, the median survival is around 15 years, is because of what we call coronary vasculopathy of the new heart, and there seems to be some kind of a chronic rejection. So the mechanism of those blocks is different from primary ischemic heart disease. But even in those situations, statins actually have a beneficial effect, apart from other immunosuppressive drugs. So statins are our friend. So we put patients that any patient I operate on for either bypass surgery or transplant would be on statins of some kind.
Yes.
They're
Dr.
extremely
Manchanda, can
useful.
you add to that,
Yes,
please?
I think they're extremely useful drug
Yes.
for the prevention of coronary artery. There's no question about it. For secondary prevention.
Secondary prevention,
Primary
yes.
prevention, there is still a doubt. High risk cases should be given. And the dose should be high. As Dr. Kapadia said, after myocardial infarction, the dose has to be 80 milligram. We stop it after some time, but it should be continued. There are studies now to show 80 milligram is tolerated very well and all that thing. And only problem with the statins is new onset diabetes. So
Okay.
should not be given indiscriminately for primary prevention. About 10 to 20% of the patients develop new diabetes, which is of course outweighs the risk of benefits. The benefits are there. You see, we are producing a large number of diabetics in our country. We have a concern of that. So anybody who is taking statins, especially high dose, should be monitored for diabetes. That is the only, but the advantages are too much. I think this is one of the biggest advances in cardiology. Lipids, they have reduced the mortality significantly, more than any other intervention. As you asked him a question, I will just like to answer.
Please.
Why the heart disease has decreased in many countries. They have tried to find out, is it angioplasty, is it bypass? They found that 70% of the reasons are lifestyle changes, just lifestyle, and the another 20% are drugs like statins, ACE inhibitors and so on. So some drugs have really decreased it, and lifestyle. Angioplasty, bypass have contributed less than 5%. Although they may look very, very good, they may relieve some pain of the patient, but in relieving death, they are not outweighing the risk, as even giving up smoking, for example, is much better than doing an angioplasty as far as the benefit of reducing heart disease is concerned.
But I will add something. If you, amongst other things which I think, as Dr. Manchanda said, the incidence is coming down, is
in Western countries,
not
in India, not in India.
Precisely, that. Is in fact we discussed it in a break. If you look at the role of, say, the American Heart Association, those are dominant organizations, and their messages are taken seriously. Whether it's limiting salt intake and controlling blood pressure, or mandatorily to publish in every the pamphlet of every food available in the supermarket, the nutritional contents of that package. In most restaurants now, if you go, it gives you the caloric value and the.
True.
In this country, that doesn't necessarily hold true.
But that necessarily may not affect the people.
But people are more aware of what they're eating.
Obesity is increasing in the Western, you see. The mind control is important.
No,
this is very important.
For those who want it, that information is available.
It is available, but in spite of that, the obesity is increasing in America, in the European countries. They know it's bad, still they take it. And this is where I think meditation
mind control
is important, because they know it's bad, still they're doing it. As I said, my patients know exercise is good, still they don't do it. Why don't they do it? Because the mind makes some excuse. Today you can have a burger, not tomorrow. The tomorrow never comes. But you see, in spite of all that, the obesity is increasing in the United States. This is going to be the biggest problem. 50% of the Americans are going to be obese, and Europeans. At present, 33% are. And they don't know how to tackle it. In spite of all this warning, nothing is happening. So I think the approach that we have at least experienced, myself and Dr. Kapadia, is that we must try to teach them meditation or a universal healing technique so that their mind is under control.
Coming back to food, Dr. Balakrishnan, you pointed out about this, the nutritional values and all that. But, you know, and again, this question I'm asking because of a lot of articles in the media and people comment. Any comments on processed food? Because there's a more processed food available in this country. Vis-a-vis, we are a society where we've been used to taking fresh foods, you know, and then we started storing in the fridge. Today there's processed foods. So any comments from your side, please?
Clearly, fresh food is superior if you have access to it.
Okay.
But lifestyle changes being what they are, in big cities, often we have no other choice, or people think they have no other choice.
Okay.
I also have grave doubts about the Indian FDA equivalent of the certifying authorities,
Okay.
how reliable those safety of those processed foods is in terms of whatever it contains, either in terms of preservatives or the kind of infrastructure which is used during those preservations. And then the salt content of all kinds of processed foods is enormously high. In fact, tastier a food material is, more unhealthy it seems to me to be. And coming to salt, increasingly it's been recognized for a long time, not only in heart disease but in the incidence of renal failure, for instance. Sodium is considered one of the villains. To a large extent, is also a matter of taste. If you for the next 15 days, if you cut down your salt intake by 50%, initially you'll struggle, but after that you'll find it difficult to eat in a restaurant. So it's an acquired taste. But awareness of the nutritional components to your health, at least to a large extent, that will make people think before they put anything to their mouth. I mean, I often use this as an example. When we buy a car, we often drive 10 kilometers to a petrol station which we think gives you unadulterated petrol. But we don't give that much thought to what we put into our mouths.
Okay. It's interesting. Yes.
You're right. Processed foods and the refined foods are the biggest culprit for the heart diseases. Report in British Medical Journal. You know, we get these imported apples, etc., which are plucked 3 months earlier and they're kept in cold storage and artificially. The food value is zero. Antioxidants and fiber, etc., is very poor. So we should take fresh fruit
As far as
and
possible, fresh
as far
foods.
as possible, seasonal, which was a part in our country.
Yes.
Now you can get throughout the year, which is not very good. Secondly, we should not take refined food. These are the two biggest culprits. Thirdly, as he said, fast foods in India are completely different. Even these big chains, I was surprised. There's a suggestion that the use of fat they use, the salt they use is much, much higher. This will be never approved in the Western countries because the amount they use. So therefore, as he said, I think we must have the nutrient which should be written outside how much salt is there, and they are completely different, and that's why I think we are getting this disease much more.
I saw a TV program last week in the BBC about a major pizza chain in India. I don't want to wish to name it.
Which was
where instead of using cheese, they're using a substitute which contains fat and mayonnaise to make it taste like cheese. So, and when a BBC correspondent tried to interview them, they kind of shut it off. I saw a major program. So the Food and Drug Control authorities in this country
should be strict.
So the
should
regulatory
tighten up.
authorities
I think so.
should be more aware.
I wrote an article long back. Veggie burger is much worse than hamburger because the amount of fat, mayonnaise they use is much, and nobody bothers here. Because it's a veggie burger, it means vegetarian.
Veggie
It's
doesn't
much
necessarily
worse.
mean it's safer.
Veggie means it's not safer
Safe,
at all
yes.
because the amount of mayonnaise.
Again,
and
it's a
deep
question of
fried.
perception. You know,
Yeah,
you think veggie may necessarily mean safe,
Yeah,
but
it is
how it is served, what additional things are put in it, that's very
I checked
important.
it up. They deep fried 3 times, you know, the
Yes.
potato inside, and
Yeah.
then they put so much of mayonnaise, which is so much fat.
And other supplements.
Yeah.
Now, Dr. Kapadia, coming back to Universal Healing Program, how do you intend to take it further? Because you have brought it to this level more in Gujarat, Ahmedabad and Gujarat. But as we have discussed today, the key essential components of universal healing, and that too, like you said, the dietary control, the exercises, and the Savasana and meditation. How can we take this program a little ahead for more awareness in the country, sir?
Look, we are trying our best, and we have put all the whatever experience we have on the website universalhealing.org.
Yes.
One word, universalhealing.org. And we have got an application which is also free. We put a capital UHP on a Play Store on that, and we can download all the things that we have been doing up till now. Then all our publications are also All the publications also can be downloaded free of cost. Everything is there. And now I'm very proud and happy to tell you that the program that we have been doing it for last 26 years have been approved so much that it has been called a Gandhian program, in the sense that it is a program which deals with the basic things in life, you know, not only health, but in many respects it promotes universal brotherhood. So when you become one with the breath, I found that people lose their prejudices and all that, and they become more friendly, they lose their hostility. And as I said, one report, the recurrence of angioplasty in some people, you know, the failure of it was related to hostility score in one of the papers. So the hostility and all that can be reduced over and about why I called it universal healing, as I said before.
Yeah.
It was started for coronary heart disease. Yeah. But then I found out as I doing that it is healing the whole individual, and therefore we call it universal healing. And now I'm convinced, forget about the name to it, but if people can practice for 10 minutes twice a day, the simple technique of how to relax the body and mind and become one with the breath, simple, burn the breath, then that will change, because I've got experience of large number of people in feedback and all that they can do it. And now the Gujarat Vidyapith, established by Mahatma Gandhi in 1920, is going to celebrate the 100th year now very soon. They put up a hall, Universal Healing Center Hall, and that they are going to promote the whole program from there, from that institute. So that will be, I think, give a great push, and it comes from there. Yeah. And we are trying to popularize it in many ways. But this label that it is a Dr. Kapadia's program or Dr. Dinoni's program, no, that's not the issue. The program is of the whole humanity at the moment, as Larry Doshi says. Yeah. You must read all the references of Larry Doshi on this program. Okay. This program is of this doctor, that doctor, now every one of us, where the crying need of the hour is universal brotherhood. Okay. And you know, as Rabindranath Tagore said, that I will not sacrifice nationality for humanity. Yeah. You see, that extent he was concerned. He found Gandhi. He told him that I agree with you at the moment, all this struggle and all that, but this nationality, there is universality. There is no borders. Okay. Borders were not seen by that fellow who went up to the moon. He saw it is only one globe, and we fought the border. So many things are coming up now in every way. We are disturbing. So this program, I've been a student of literature only. I've never studied medicine. First 5 years of medical, I just wasted them. I never take up the thing for dissection. The other partner was dissecting. I was just watching it. So the whole literature I wanted, but the literature came in the treatment of coronary heart disease, which I think is not only a physical problem, a coronary heart disease, but it is a very important spiritual, mental problem, coronary heart disease, apart from the physical. And the treatment of it also requires a very great aspect of understanding the patient, talking to him and explaining to him, and of course the armamentarium which we have got now. So Universal Healing Program, I wish that it becomes a regular practice for each person on this planet to practice for 10 minutes twice a day. But let it not be known as Dr. Kapadia's program.
See, already I think the government is helping quite a lot. Our Prime Minister has made yoga almost popular all over the world.
All over the world.
And the yoga is exactly similar to what it is. It's not only a few asanas. It's not meditation. It's a complete holistic way in which the diet is important, in which stress management is important, and that's why it's becoming now compulsory in schools. In the United States, I am told, my friends have done research, they are going to make it compulsory. So there's a big help coming to him. Our Prime Minister has made more or less yoga now almost compulsory in schools and universities and at early level, and I think that's going to be a big boost. He has already shown the scientific. We have shown also some data. But from early childhood, if this yoga can be incorporated, which is similar to Universal Healing Program, I think this will go a big way.
Thank you.
This should
Now,
be,
yeah, please.
I think also popularized amongst doctors, because there's evidence that the average life expectancy of a doctor is 10 years less than the control general
Oh, that's
population.
a startling revelation.
No, no,
Sure,
fact,
it's true. It's true.
It's a fact.
We all died 10 years earlier. because
Cardiologists
we
have heart
practiced-
disease, you see.
Oh, yeah.
And it's glad that every hospital now is going to have a yoga.
See, Dr. Balkrishnan, you are part of a Fortis group, and in India, there are so many now corporate hospitals coming up. And what in your views where the corporate hospital chains can help in prevention, not only of heart disease, but basically the preventive approach, rather than curing? Yes, it is healthcare is a business, that's very true. But also there is a kind of a social, corporate social responsibility of the healthcare sector to contribute
See,
in
we have
prevention.
they have a preventive medical checkup program in most hospitals, where
Okay.
Unfortunately it functions more like a battery of tests and annual
Yes,
checkup.
I'm talking further than that, if we can.
So
do
it has
something.
to be, I think, it has to extend beyond that to maybe classes on wellness.
Sure.
Dr. Manchanda and Dr. Kapari talking about. And as I said, advice on sensible living.
Yes.
Now, these are idealistic aspirations. The moment you finish that and go back to the real life where dog is eating dog, you have to, you get back into the world. So, but I think that increasingly in workplaces, people have, at least in the corporate world, not in hospitals, where there is a gymnasium, for instance,
Yes.
where there's a shower, there's a sauna,
Yeah, a
there's
lot
a
of IT
meditation room.
companies do have this.
Yet, I never see that in a hospital.
Okay.
Paradoxically, the places where we heal in our country seem to have very little space for prevention or for wellness of people who work in those, because space is at a premium. And unfortunately, unlike IT companies or other companies, which have the luxury of being located outside the city where
True.
the real estate costs are low,
Yeah.
by the very nature of its business, hospitals tend to be in the heart of the city where patients find it easier to come. So the real estate values are crazy in this country.
Yes.
So they don't want to waste any available space on anything which even remotely resembles as amenities to the people who work there.
Okay.
Is it true or not?
Absolutely. Yeah, preventive checkup should be modified. We have modified in our hospital.
Okay.
We have a yoga teacher, we have a psychologist. Because I tell them health is not mere absence of disease.
Okay.
It's a state of physical, mental,
And social
social
well-being.
and spiritual well-being. And
Wonderful.
that includes the universal program.
Wonderful.
Universal sleep.
Correct,
So this is exactly, I think, if they can slightly modify these,
Yeah.
which are not difficult. I know many corporate hospitals which have a psychologist.
Yes.
Because a patient comes to me, he says, my tests are fine. I am fine. I say, you are not fine. Because my psychologist tells you get a lot of anger. So you are mentally not healthy. So I think that concept, if it can come in the corporate hospital, it will be very good. Many corporate hospitals have so-called well-being clinics also.
Okay.
Well-being is
Or-
also incorporating.
Okay.
So that will be paying. I can tell them.
Sure.
In Gangaram Hospital, we have a yoga teacher who gives class to all these people who come for preventive
Yeah,
checkups.
so all
that-
this stuff,
yeah,
the doctors, the
it's possible.
paramedics and everybody.
Yes, it's
Yeah.
possible.
And thank you, doctors. And before we conclude, the last comments from Dr. Ramesh Kapadia, please.
I tell you, I've got a beautiful comment to make.
Please.
First time all these years, that I have been a resident of India, and now traveling all the time to United States and all that. First time, a commissioner of health, joint commissioner of health, happened to be she. She approached me and she said that your program is so wonderful and we want to take it to every school in the class and all that.
Wonderful.
Now, I should say that when would I tell the government to do it? Because here, unfortunately, I don't want to comment on this, but in the United States I have seen that wherever there is merit, the authorities approach them.
Yes.
Here the merit, but first time I found the merit approached by the authority, and that has really
a good sign.
encouraged me to work very hard in this respect, and I hope we will be successful. And I'm very thankful to these two doctors who came to sit with me for this discussion at a very, very short notice.
Yeah.
And therefore I'm most thankful to them.
Yeah. Thank you, Dr. Kapadia, Dr. Banchanda, and Dr. Balkrishnan. Viewers, I'd like to conclude that I feel this session has been a great take-home for all of us, for the patients. All these experts have clarified a lot of issues dealing with heart disease prevention, and also we talked about the common well-being of people today, and the preventive part, which is very important for the people of our country, and especially for the young people, because they comprise the majority population of our country. We are grateful to all the three panelists who shared their thoughts on this subject, not only for the treatment, curing, prevention, but also their views on what things can be done on the macro level. And we also wish Dr. Kaparia's Universal Healing Program spreads to more people and more states in India and more countries in the world for the well-being of all human beings. Thank you, viewers.